Patients come to us with neuropathy complaints that usually include one of two things: balance trouble or sensory symptoms. The sensory symptoms usually involves the legs being numb, tingly, sometimes having pain in the feet, usually burning, sharp pains. The balance trouble, patients might feel like the equilibrium's off, they might be prone to falling. And with that falling difficulty, patients might need physical therapy to help prevent falls and maintain their balance. For the sensory complaints, we might have patients get nerve pain creams or nerve medications to help control the symptoms. And here at DCND, we can help with part of the workup, which might include labs for potential reversible causes of neuropathy, which can include diabetes, vitamin deficiencies, thyroid issues, protein problems in the blood, which sometimes can be under the radar and cause the neuropathy, which then can be treated and prevent the neuropathy from getting worse. We do nerve conduction tests here, which can look at the severity of the neuropathy or the type of neuropathy. Not all neuropathies are the same. There's more common ones than others, but sometimes other ones can be more inflammatory and need different types of treatments, like IV treatments. So on the EMG, we get a lot of data. Some of the data can tell us how severe the neuropathy is, if there's been axon loss, meaning that the actual nerves have been damaged, or if the conduction is just slow through the nerves for some reason or another. Is there just a block in how the nerves are communicating? And then sometimes there's other things going on in addition to neuropathy. You can get pinched nerves coming from the back or some impingement of nerves in the legs. If you're starting to have some of these symptoms that are not out of the ordinary, sitting on your leg and it falling asleep, we all experience things like that. But if your feet are always numb, always tingly, if they're starting to feel burnt, if you're staggering around the house, grabbing onto furniture, grabbing onto walls to maintain your balance, you really should get evaluated because something more serious could be going on. So primarily when we treat the neuropathy, we will treat the pain symptoms with nerve pain medications, sometimes nerve pain creams if patients don't tolerate the medications well. For the balance issues, we'll get patients into physical therapy to help maintain their balance to prevent falls and injury. And then if there's more serious types of neuropathy, the inflammatory type neuropathies that I mentioned, patients may need IV treatments to prevent the nerves from getting damaged further. So the prognosis on neuropathy varies kind of widely. If somebody has neuropathy due to diabetes, if their diabetes was just diagnosed and they started having neuropathy, if you get that under control, it could prevent the neuropathy from getting any worse. If you've had diabetes for decades and you're having neuropathy symptoms that have been progression over decades and decades, even if you get your diabetes under strict control, the damage has been going on for so long, sometimes the nerves may not heal fully. Other things that can damage nerves, alcoholics or heavy drinkers can suffer from neuropathy as well. Therefore, getting their drinking habit under control can help prevent it from getting worse.